Good morning. Let me be the first to take Dean Dennerlein's wise advice to say thank you early and often. To thank him, the Sargent Convocation Committee, and all of Boston University for giving me the honor of meeting you. Also, I had the honor and exciting pleasure of sitting next to your valedictorian, Brianna Spiegel. Congratulations! Your degrees are a huge achievement that merit huge congratulations. I may teach master's students at the Tufts Freidman School of Nutrition Science and Food Policy, which has about the same number of syllables as the Sargent College of Health and Rehabilitation Sciences. But I only have a BA, and it was in English. Bachelors of Science are hard. Masters are hard. PhDs are really hard. They take time. That makes you all incredibly impressive, and it's an honor to get to talk to you. It's students like you who can change the world for the better, who have the tools to improve life for both individuals and entire populations. You're the people I get to teach. You're the people who can be a part of the food policy program I created at the Aspen Institute, Food and Society, which is dedicated to making significant changes in food systems toward equity and sustainability. What an English degree did equip me to do was spend several decades as a restaurant critic. Most people, that sounds like a dream job, and it was fun, especially being able to treat friends who otherwise wouldn't have access to fancy meals. And at least in the days before online took over print, somebody else paid the bills. You do eat some great food and a lot of bad food. As a critic, you're focused much more on observing everything that's happening in the room and guessing what's happening behind the scenes than you are on what's on your fork. Food does make good stories, and most often it's made by good people, people who want to create families and communities through food and leave them feeling better. I started writing more and more about nutrition, how to make the most widely available and affordable food promote better health. I found people to admire, executives and scientists who work for global corporations that have the potential to make food on a global scale, and I found dedicated, warm-hearted, inventive people from grassroots organizations who were improving food in underserved communities against formidable odds. Years of interviewing these mission-driven people made me think how much more significant their work could be if they came together to share ideas, share their core values and hopes. Bringing people together who may not be like-minded but do share common ideals is exactly what the Aspen Institute does. Creating a program there seemed a much better long-term road to making long-term change than writing one-off articles. As fun and gratifying as it was to write cover stories on pasta and bottled water for the Atlantic and Times Magazine, regular restaurant critic reviews, and pieces in Vanity Fair. Food touches on everything important in life. As you've certainly heard, social determinants of health are a part of every current theory of what leads to improved public health. Housing, transportation, and food access are perhaps the holy SDOH trinity. I'm prejudiced. I hope that if it comes to a choice of which determinant you'll work on, you'll all choose food. Not just because I like and admire the people who make and care about food, but because health sciences equip you to interpret and implement nutrition data. This is commencement, so I shouldn't ask for a show of hands on anything except how proud you and your families are that you're graduating. I will ask, though, how many of you took Sargent courses in nutrition, and how many are thinking of making healthful diets a part of your careers? Hands? Ooh. Okay, it's my congratulations. It's my mission to persuade you and more of you to make food and diet integral to whatever you practice. Why? Because along with maternal and early childhood health care, nothing matters more to future health than a healthful diet. Look at the grim statistics during COVID. Underlying illness, much of it caused by poor eating habits, led to dramatically elevated rates of illness and death, particularly in Black and Latino populations. Today, more than 350,000 annual deaths from cardiovascular disease are attributable to poor nutrition. Identifying how dietary interventions can meaningfully influence individual and population health then is a national priority. It's clear that widespread access to and enthusiasm about a healthier diet will make for a healthier population. How to change habits and improve health outcomes. How to prevent diabetes and diet-related illnesses from taking hold. How to reduce the impact of those illnesses by reducing disease management costs. This is the promise of Food is Medicine. It's a field I've devoted most of my adult life to. First as an admiring onlooker and cheerleader at Community Servings, a Boston grassroots organization that's now a national leader in Food is Medicine, and then as an active program leader at the Aspen Institute. Community Serving started in 1989, a time when HIV activists were tipping the balance of control into the hands of patients. The way that many of us who were not medical professionals found to help and to fight our own sense of helplessness was food. The original impulse of Community Servings, of which I was a founding board member, was to involve Boston's best chefs in designing menus for people facing a life-threatening illness. From-scratch meals delivered to the door of patients who were isolated and frightened brought them hope, aid, and comfort. The name of a benefit evening at TD Garden that gave rise to Community Servings. Julia Child even came. I'm pretty sure I was her designated driver that night. I saw a lot of her in those days. She was game to attend. It was a little out there to support HIV causes then. The event showed the power of community action and cohesion in a time when there were no easy answers. Aid and Comfort was my first taste of asking people who'd worked hard to make a name for themselves, bringing good food to others, to help people in need. And boy, did they want to help. As I would see decades later at Food and Society, when I formed a group of restaurant owners and chefs to protect workers during COVID, something we did with Jose Andres and country's large and small restaurant groups. Food people are generous. They care about community. But the missing piece, a research-backed plan for healthful diets, and which foods will bring the most significant improvements to patients who have which combination of health needs. When David Waters, who's been CEO for going on 30 years, took leadership of the agency, he understood that chefs had to be as skilled in understanding nutrition as a form of health care as they were making palatable and culturally appropriate meals people would eat. The insights and practices of meals designed to improve patient health can apply to a wide number of illnesses and conditions beyond HIV, which at last was being brought under control by new drugs. So the next step was to solidify a nexus to the healthcare system. That's the core definition Food and Society uses for our Food is Medicine Research Action Plan. Formal ties to healthcare systems are what will keep the field of food as medicine alive and growing, will broaden client and patient eligibility for meal reimbursement. That's the case Food as Medicine research makes. Understanding a client's full range of health needs, being sure they can get meals to make and keep them well, is what advocates want to see baked into all healthcare payer criteria. How to move beyond the promising but ultimately limited world of pilots, which is where current large-scale food as medicine provision takes place, wide-scale research, wide-scale program evaluation using common metrics. I'm looking at all of you because you are the future. That's what made Food and Society spend going on 5 years now writing our research action plan. With a collaboration of a brilliant team, we assembled all the peer-reviewed research into medically tailored meals, groceries, and produce prescriptions. In easy-to-follow charts of visualizations. How many of you took data visualization here? It's crucial to making health concepts understandable and actionable. We show which interventions have the strongest effects on health indicators like A1C levels, type 2 diabetes management, hypoglycemia, and overall nutrition security. The first peer-reviewed research showed dramatic decreases in emergency department visits and diabetes and other management costs, the data payers most want to see. But that's over the short term, the term payers work in. The winning long-term argument for food as medicine is what happens in the long term, encouraging eating habits from infancy onward that will prevent diabetes, hypertension, and cardiovascular disease. And the sticky truth is that return on investment for prevention and simply giving more food to people who need it is hard to show in the periods payers and politicians want to see, even if the benefits to society will last for generations. We're fortunate that our Food as Medicine Research Action Plan has become standard reference for providers and agencies getting into the field, and the National Institutes of Health quoted from it in its concept for Food as Medicine Centers of Excellence. The NIH even embedded our recommendations for making equity a part of research design, implementation, and evaluation to their own recommendations. A word on equity in research. It's easier to talk about than it is to practice or get funded. Equity principles include being sure research designers and evaluators are as diverse as the community they study. Another goal I feel particularly strongly about is staying involved with study participants after the implementation phase of a study is finished. I call this the what happens when the circus leaves town problem. A plan for maintaining access to healthier food, the ability to cook and use it, and continued access to the kind of counseling and health care that are a part of rigorous studies is an obligation researchers know about and want to honor, but it's not an obligation they're usually funded to offer. There's huge promise. An exciting new crop of researchers and agencies are entering the field. Of course, I hope you're going to be part of them. The next phase of our work in food and society is a best practices guide to starting food as medicine work in community-based organizations and food banks. It's exciting to get introduced to us, to more of them, and to you. Engaging communities is what brings real health, but I hope will motivate you as you travel from job to job. Which community? Well, start small. Get involved. Whether or not you make food access your own cause, look for a community to join. Eventually, with one or two good experiences behind you, if you don't see the ideal community you'd like to join, you'll build your own. That's what we've done at Food and Society. In addition to our other initiatives, we have a Food Leaders Fellowship, which brings together 18 leaders every year from all parts of the food system bent on making change towards sustainability and equity. There's plenty more to do. Looking for problems? Well, why are ultra-processed foods strongly correlated with obesity and poor health? The actual scientific mechanism yet to be found. Policy? Protect SNAP recipients' food stamps when scammers steal information from their EBT cards and drain their accounts. Those are just two examples from the past month's news. Expand WIC, Women, Infants, and Children, benefits for young parents and families, the country's first and most effective food as medicine program, but one that's under current threat from Congress. Make healthful school breakfasts and lunches available to all children, as Boston and Massachusetts have been way ahead of the curve doing. Or work to do what successive administrations could never get done, force food makers to significantly reduce the sodium in their foods, not just obvious examples like soup, but the places it hides like bread. Even if you don't have core interests related to food, don't find a job right away, volunteer. You might just find a life partner. Worked for me. In community serving's early years, I constantly heard about this guy, John Auerbach, who began the first AIDS Bureau at a state health agency and later became Commissioner of Health for Boston and then Massachusetts. He too was a founder of Community Servings, but not on the board. We didn't overlap until the day we met at an awards lunch more than 25 years ago, and we've been together ever since. His insights about how to make conditions healthier and healthcare accessible to everyone are my inspirations in my professional and personal life. So, there are all kinds of uses you can put your shiny new degree to work doing. Finding work, unpaid or paid, with a group whose mission inspires you will bring you into contact with a community of people who care about what you do. New ideas of how you yourself can make change. If you find a place that lets you learn and grow and build your self-respect. Even if it's not directly on the path you've laid out for yourself, stay there. And did I say wear sunscreen? Wear sunscreen. My many congratulations to you on the discoveries, unexpected turns, and increasing ability that wait you to turn ideals in science into action. Congratulations.